theatre, and that not necessarily being helpful when people go to back to the real life settings. We were discussing capacity building has a role, but we need to understand the framework and the setting, the cultural setting, to know what the capacity already is and what can be sort of further developed and what's there. So we didn't throw capacity building out, but we saw that it was something that was quite, could be system or setting specific. We were thinking a little bit about, we did have a bit of a discussion about basic capacity, like so that there's a kind of, a bit like basic first aid, look, listen, link, those sorts of basic structures that you know that our civil society groups have, are familiar with, but we might have now a common language about it, so that if there is an emergency, we can sort of work with it. So we didn't come up with anything definitive, but we saw capacity building as having a role to play in spite of the complexity thereof. There was just one other discussion, which is about mental health itself, because some things like we could teach everybody to, I don't know, ride a bike, and that's concrete, and the problem with mental health is that it's not tangible. So what are we capacity building in? And so that was a bit of a discussion. If you go right down that pathway, I'm fearful that we wouldn't do anything because mental health is so sort of hard to define. So then it was, what's the elements that we want to develop? So thank you.
Thank you so much. I go over to the second breakout group without knowing where it is, but I see, but I see some colleagues. Who of you will report? I know you were in informal conversation. What is William? Can you go ahead? And please be brief. Thank you so much.
I can assure you that. So I'm going to speak on behalf of my smartest colleagues here. So our conversation started by a simple question. If you have a humanitarian crisis and you get funding for 3 months, what kind of capacity building can you do? And then we moved away from that, and after the conversation, and we focused on capacity building shouldn't just be about building skills, which is very important from the initial conversation we have had. But how can we then build institutions so that they can do even bigger things? Talk about grant writing, talk about budgeting, as simple as it may sound to say budgeting, but these are issues that organizations struggle with. So our focus was it has a place in our work, but it should transcend just skill building and also include organizational development. Thank you.
Thank you. Which breakout group were you in? In the same. Okay, I have to find another breakout group. Who hasn't reported yet? Yeah?
Right. Yeah, so we looked, I suppose, at the sustainable systems piece, and some of the points, thank you, Tanya and others in our group, who were talking about the example of Lebanon and say, challenges to capacity building when most professionals, the vast majority, 90%, go to work in the private sector, and that is completely out of the reach of most people who need MHPSS support. Then we also talk about the role of international organisations in terms of, I suppose, providing funding, but the sort of dichotomy between, for example, salaries and security of contracts for international staff versus the position of local professionals, and this being a huge issue and a question of privilege. And then just in terms of within the context, people who have the knowledge, have the kind of shared experience of situation, and this applies across the board, even in Ireland, whereby, for example, people coming from displaced backgrounds who are mental health professionals then being excluded from the workforce here when they could bring so much. Likewise, in some of the situations that we discussed, the role of the local staff versus the kind of the fly-in international. And I think, I can't read my own writing here, so yeah, so it was looking at, I suppose, developing joint structures that are based on justice and are accessible to people. Is that okay?
Amazing, thank you. Next group, please.
Hi, I'm Eve Puffer from Duke University. Our group talked about several interesting things, but the two main ones were first that we should reevaluate the term capacity building, because sometimes that can imply that someone needs something, and if they don't have it, that they won't be able to do effective work. We did not have a good answer for that. Ideas, but no perfect answer. The main thing we spent a lot of time talking about was training people in processes and approaches for things like intervention co-design, intervention adaptation, building in some flexibility from the beginning so that you don't end up with these rigid intervention developer, train the trainer in very specific skills, which often isn't sustainable when people move on from their jobs, but instead training people on processes and approaches. And as you do that, we had some good examples of integrating some reflective supervision, reflective processes with local participation to support organizations as they're trained in these processes and approaches. So we also didn't throw out capacity building, but doing it in maybe some different ways.
Thank you, also very important points. They are all being collected and documented and shared afterwards. We should have another group. Yes. Which mic is Nira? I run to you.
Thank you. So our group was very multidisciplinary in nature. We had nursing, social work, arts, and humanities, theology, and public health. So we were thinking, what is MHPSS? First, you cannot address that without addressing physical and spiritual health as well. So it's very important as we go to capacity building that we also stabilize, physical health, spiritual well-being, include those in our interventions. We talked a lot about pipeline programs. We talk a lot about equity and bringing people with lived experiences and displaced and war-affected communities to become the next generation of leaders, to deal with corruption in countries, to become the politicians in place in the future. And how we do that is through pipeline programs that start in universities. And now thinking about universities and the movement that the students are doing in today's world. In this campus now, the university is closed because of a global movement of the youth. So really embracing that and centering that in our capacity building as well. Our students here can have so much talent and can be displaced themselves, so starting with that. Lastly, we talked about the context and the intervention targets. Sometimes your intervention target are not just women, but men or family structures. So thinking again about capacity building, not just as individuals, but rather what is your unit of intervention. Did I miss anything else? We're good? Okay. Lastly, women are a big piece of peace building sustainability. So really thinking about sustained capacity building, bringing women to the center of the conversations.
Thank you. Amazing how different the discussions were happening in those groups, right? I think we have one last intervention here in the corner. Yeah. Thank you.
Hi. Yeah, so I'm going to share the mic with my colleague in a second, Lausanne, to share also with us, because he gave us such a fabulous practical illumination of some of the issues we were talking about. So maybe we could share the discussion. So we began with the reflection, what do we mean by capacity building? Is it simply about skills? And we also reflected, skills in the sort of and workforce development. And we also reflected on the sphere pyramid. And we're thinking about what we'd heard today and, whether or not I think it was Professor Toll mentioned self-help and the extent to which, if capacity, I don't like the word capacity building as well. I think, how can we work with the assets that we find within a given population to strengthen their ability to be mental health first aiders. And I would start younger than university. I think young people can do an incredible job in terms of providing support and supported self-help within, school environments. And so really thinking about those innate capacities within communities that we can build on those strengths and the networks that need to be fostered in order to create that more supportive environment. And then we had this fantastic practical example of how that works here in Dublin as as a city of shelter. I don't know if you wanted to, city of sanctuary. And sort of the work that goes on here to provide that at that sort of non-professional level of mental health intervention, to provide that support and enabling environment for people who have been displaced as a consequence of conflict. So it's just recognizing that there's so much that can be done at that base level of the pyramid, which creates the conditions to sort of strengthen the pyramid as you come up. It creates a sort of natural progression for people, and it also enhances preparedness. It creates a basic resilience, hopefully, within a population. So I don't know, yeah, have I covered it? Okay.
Thank you. I think we covered it all, right? Or anyone? Okay, great. Thank you for this amazing group work. And I hand over to the main facilitator.
Hesitating. Okay, so we're reaching the end of the first day. I think it's actually flown by, and I'm going to hand back over to Teresa Betancourt and also to Rena Gaffer Khan. I hope I'm pronouncing that somewhere near correctly. I've already introduced Teresa this morning, so I won't introduce her again. You all know who she is at this stage. Rena, though, is the editor-in-chief of the Intervention Journal and senior MHPSS technical advisor with ARC International. So they are going to now kind of give us some comments to round off the day. Thank you. Teresa, we're starting with you, shall we? Yeah, thank you.
Yeah, it's been an amazing day, and I'm actually reflecting on some of the learnings that I had working with Paul Farmer at Partners in Health, who really advanced what Paul discussed as the field of global health delivery, which is another way to talk about implementation science. And Paul had this really nice, simple way to talk about what are the things we need to deliver at scale with better quality and sustainment. And he talked about staff, and I think today we've talked about workforce. We've talked about leaders and leadership. We've talked about interventions to promote leadership. And we've talked about pipeline issues in building. We like to use the word mutual learning rather than capacity building, because we get just as much as we give, and oftentimes we don't even give as much as we're getting. The other nice part of Paul's simple 5-point plan for global health delivery was stuff. We've talked a lot about stuff today, the evidence-based interventions. We've come far. I think we need to celebrate that back in 1995, we had no landscape, and now we're talking about reviews of reviews and meta-analyses. So the stuff we have to work with in our delivery has really come far. And we're also talking about innovations for co-creation. So working with community partners, working with people from lived experience to think about the end user, to think about the fit and the feasibility in that environment. And I think we've talked a lot about, too, in Paul's metric, space, which are the settings for delivery. And there's been a very interesting conversation today about almost typologies of conflict, where we are on that developmental course from, chaos and no governance to countries where really there's leadership and they're coming out of conflict or they're hosting displacement. So starting to think along those settings and spaces for delivery, I think, is also important. And then Paul talked about systems. And we've talked a lot today about getting out of silos, that we have this problem of coordination. And in the Nexus that we're talking about, we too often stay in our silo. So how do we start to think of funding structures that incentivize that movement out of the silo, looking at the long term? How do we think about how we can organize ourselves in teams and arrive at better teamwork to move forward along that continuum in the Nexus? And then lastly, Paul talked about social support. And I think what we just discussed in our small groups was about, yes, you can train local people, non-specialists, but just training and then leaving people, to do very hard work in trauma-affected situations in mental health is also unethical. And we have to think about do no harm. do no harm should, or the ethics of what we do should come first. So the supportive supervision, the structures to uphold quality as we move it forward. So I think it's been an exciting day. I think tomorrow we've got a great agenda. I am going to cede some of my time to one other journal editor, because we're going to have both Greg Ahrens as well as Rena talk about the works that they're looking for in their journals and publishing. Just to give you some background on Greg, he's a professor and director of the Child and Adolescent Services Center and co-director of the ACTRI Dissemination and Implementation Science Center at the University of California, San Diego, and he's the editor of the journal Implementation Science. So maybe, Rena, do you want to come up and talk about intervention in the journal? And then Greg, we'll have you just hearing, someone who doesn't work in the humanitarian field, but you're hearing all of these dynamics and the discussions. Give us some reflections back, and then we'll close up. Thank you.
Great. Okay. So thank you to the organizers. I'm too short for this stand, and actually, I'm going to move here. Is that okay? Yeah. So thank you to the organizers for such a great first day, and also just this space. I know literally it was a bit difficult to find this space, so thank you for this space to discuss the important questions happening today. And indeed, I'm the editor-in-chief of Intervention Journal, and I know many of you have read Intervention Journal, have published in Intervention Journal. Our former editor-in-chief, Peter Ventevogel, is there. Rebecca Horn is our editorial board member. But just for those who don't know, I want to tell you a little bit about what we do, and also share 2 points with you on some of the ideas we're having. So Intervention Journal is an open access, peer-reviewed scientific journal on mental health and psychosocial support in conflict-affected settings, or settings dealing with the aftermath of natural disasters. And I think a lot of what Intervention has been doing for the last 20 years, it goes back to a lot of the discussions we've been having today, which is about bridging, co-learning, mutual learning. We publish field reports where we actually learn from what is being implemented in the field. What can we learn from what is happening in field offices? And we publish scientific articles. Actually want to reiterate what Teresa was saying about the importance of writing down what we do, what we learn, and especially the conversations happening today. I think we can all see we're kind of pioneering here. We're trying to find new language, new areas of working together, breaking barriers, and I think writing down this learning process, sharing what we learn through this process, I think it's so important. Another thing that I'm really proud of what we have at Intervention are personal reflections, where actually people with lived experience or professionals sharing what it's like to do their work in the setting that they work in, what we can all learn from that. So I'm really fond of that part of Intervention's work. One of the activities we've been developing over the last years are writing workshops. So actually for people who are field workers or early career researchers to get acquainted with academic writing, because I think we all agree that a lot of knowledge is out there but not necessarily being written down. And the barriers towards publishing in an academic journal are usually very high in terms of language, in terms of just being scared by looking at the website or a submission platform. I think we can all relate. And I think breaking down some of those barriers, allowing people to develop skills in those areas, I think is very important. And I think we have so much to learn once these people start to share their experiences. Another idea that I wanted to bring to your attention is something we've been also discussing with Teresa and the organizers of this event, is a special section on the humanitarian, developmental, peacebuilding, Nexus, and MHPSS, which I think relates perfectly to what we're talking about today. And a special section on this topic is something we've been discussing with several agencies, and is something we'd really like to collaborate on to make that happen. So to talk about what have we learned so far, what still needs to happen, what could the research priorities for the upcoming period look like on this exchange between the HDP Nexus and MHPSS. I'll be around tomorrow, so please come and find me if you have any more questions about intervention. There are some interventions journals outside. There's a QR code on front you can scan. Please, I don't want to take them home, so please take them at the end of tomorrow. And yeah, welcome to hear your questions and thoughts. Right, thanks. Handing over to my colleague.
Thank you, and hello. I was a mentor for Teresa 10 years ago, but I learned so much from Teresa and from all of you here, and I just want to thank you all for that. And so I'll just talk briefly about the journal Implementation Science. So the journal was founded in, 2006, because there was no outlet for studies that focused on implementation. And so how is implementation a little bit different than intervention research? One of the things that is a hallmark is the focus on the specific outcomes for implementation research, and there are many, but often we're concerned with really bringing research into practice. So for the journal, just from the website, Implementation Science publishes research relevant to the scientific study of methods to promote the uptake of research findings into routine health care in clinical, organization, and policy contexts. Very relevant for what you're all doing. And I will say that we are very interested in submissions from low resource settings and really address some of these global issues. A lot of what we publish tends to be in kind of more upper and middle income countries. Some of the hallmarks of implementation research, we may focus on things of how does a specific strategy to implement a clinical or public health intervention, how well does it spread? What's the reach, or what's the fidelity with which those are being used? We're also, we think about different designs and study designs for implementation. And there's something called a hybrid design, where you may be looking at the effectiveness of an intervention, but you can also look at the strategies to implement those. So in our breakout group just now, we were talking about development and how development occurs. And I mentioned Dr. Betancourt's study of the youth readiness intervention, and that one of the things that the team in Sierra Leone noticed was that when adolescents who went through this group-based CBT, emotional regulation intervention, when they left those groups, they would talk to their friends about what they were learning. They would talk to their siblings about what they were learning. There was a natural diffusion process. An example of an implementation study would be to look at that natural diffusion process, but another would be to develop some strategies for how you promote diffusion of something. And that was very relevant to our breakout group, where we were talking about how can we build on, how can we help communities develop the capacity to help each other, and are there ways to do that through those processes? So we publish a number of different article types, standard research methods, debates where an issue in the field of implementation science can be raised and debated. Unfortunately, those types of articles, typically someone comes in with one position and argues, this is the position that we're recommending. We don't necessarily have that real debate, but it is a approach for bringing an issue to the field. Systematic reviews, commentaries, and methodology papers. We are open access, published by Springer Nature and Biomed Central in particular, which I am a fan of open access, except for article processing charges. But there are allowances for low and middle income countries to get a break on the APCs. As I said, the journal was founded in 2006. I've been on the team since, as an associate editor, since 2009, and then took over the last couple of years as a co-editor-in-chief. But we also, at Implementation Science, we're looking for really rigorous studies, whether it be systematic reviews, whatever it happens to be, a high level of rigor. So our acceptance rate is under 10% at that journal. But to accommodate sort of a broader reach for the field, a few years ago, we established Implementation Science Communications, which is broader and more open to discussions about what are barriers and facilitators and strategies that might be useful in different settings. So there's also a nice outlet for a range of different projects, different studies, different approaches, and different opinions in the field. And happy to talk offline about what constitutes an implementation study versus an intervention study, or how you might do one of those hybrid type trials. And so thank you for the time, and just really happy to be here and looking forward to tomorrow.
Okay, so thank you so much. And thank you for everybody for spending the whole day with us today and for providing such rich, interesting, thought-provoking discussion. And we hope to see you all tomorrow morning at 11 o'clock. Is there anything else I need to tell people? Okay, same time, same place tomorrow. Thank you so much. Have a lovely evening. Thanks, everybody.